Hello everyone, this is Albert, your Medicare Maniac, and in this section of my training, I am covering preventative services. Now, in the Medicare and You book, there are many preventive services. So what I've done is I've cut and pasted all those services into one presentation. So this presentation will be a longer one. So please get your book, open it up, and we're starting on page 30. So if you notice, it says, under Part B covered services, you'll see this apple next to the preventive services on pages 30 through 49. So the first apple you see is abdominal aortic aneurysm screening. Medicare covers a one-time abdominal aortic aneurysm screening ultrasound for people at risk. Alcohol misuse screening on page 30 and counseling. Medicare covers one alcohol misuse screening per year for adults with Medicare, including pregnant women who use alcohol but do not meet their medical criteria for alcohol dependency. Next, on page 32, and if you notice, I'm not reading every single thing in this video because there are so many. Bone mass measurement, otherwise known as bone density. This test helps to see if you're at risk for broken bones, plain and simple. Breast cancer screenings, mammograms. Medicare covers screening mammograms to check for breast cancer once every 12 months for all women with Medicare who are 40 and older. Continuing on, the next apple is cardiovascular disease on page 32, and this falls under behavioral therapy. Medicare will cover one visit per year with a primary care doctor in a primary care setting like a doctor's office to help lower your risk for cardiovascular disease. Cardiovascular disease screenings. These screenings include blood tests that help detect conditions that may lead to a heart attack or stroke. Simply put, this is found on page 33. Next item, cervical and vaginal cancer screenings on page 34. Turn to page 34, please. Part B covers Pap tests and pelvic exams to check for cervical and vaginal cancers. Plain and simple. Next item, colorectal cancer screenings. Medicare covers these screenings to help find precancerous growths or find cancer early when treatment is most effective. One or more of these tests may be covered. We just had a famous actor that played the Black Panther just pass away from colorectal cancer. Now, they do have all these different bullets, multi-target stool DNA test, and it just has all these things that you need to read about, but I'm going to skip over because of the length of the presentation. Look at all these bullets. There's 4 bullets that fall under this title of colorectal cancer screenings. Screening fecal occult blood tests, screening flexible sigmoidoscopy, screening colonoscopy, screening barium enema. So there's all kinds of things that are associated with colorectal cancer. Okay, now let's continue. Depression screenings. Medicare covers one depression screening per year. Diabetes screenings, okay? Medicare covers these screenings if your doctor determines you're at risk for diabetes. And these are all the things that they're going to do, that they're going to help you do. This blue box that you see. Following page 36, okay? Now we're on page 37, diabetes self-management training. Medicare covers diabetes outpatient self-management training to teach you to cope with and manage your diabetes. Next subject, diabetes equipment and supplies and therapeutic shoes. Medicare covers blood sugar or glucose testing monitors and infusion pumps if necessary to administer insulin and related supplies and accessories for this equipment, including test strips, lancets, glucose sensors, tubing, and insulin. Let's continue. Now we're on flu shots, page 38. Medicare covers one flu shot or vaccine per flu season. You pay nothing for the flu shot. Glaucoma test is on page 39. These tests are covered once every 12 months for people at high risk for the eye disease glaucoma. Turning the page. Page 39, hepatitis B shots. Medicare covers these shots or vaccines for people at medium or high risk for hepatitis B. Some risk factors include hemophilia, end-stage renal disease, diabetes, if you live with someone who has hepatitis B, or if you're a healthcare worker and have frequent contact with blood or body fluids. hepatitis B virus infection screening. Continuing on, hepatitis C screening test. Continuing on, HIV. Medicare covers HIV screenings once every 12 months. Lung cancer screenings. Medicare covers a lung cancer screening with low-dose compute tomography once per year if you meet all these conditions. Please read all of these on your time. I'm just giving you a general overview of preventive services. Medical nutrition therapy. Medicare covers medical nutrition therapy services if you have diabetes or kidney disease, or you've had a kidney transplant in the last 36 months and your doctor refers you to MNT services. Continuing, obesity screening and counseling. If you have a body mass index of 30 or more, Medicare covers face-to-face individual behavior therapy sessions to help you lose weight. Pneumococcal, pneumonia shots. Medicare covers pneumococcal shots or vaccines to help prevent pneumococcal infections like certain types of pneumonia. These two shots are the 23-valent pneumococcal. Okay, I'm going to stop right there, and you can read that on your own, but that's on page 43. Let's continue. Prostate cancer screenings. Very important for men. Medicare covers a prostate-specific antigen PSA test and a digital rectal exam once every 12 months for men over 50, beginning the day after your 50th birthday. You pay nothing for the prostate screening. Sexually transmitted diseases. Medicare will help you there. Smoking and tobacco use cessation. Counseling to prevent tobacco use and tobacco-caused disease. Medicare covers up to 8 face-to-face visits within a 12-month period. And that concludes this section on preventive services. As you see, there's so many preventive services, and for the most part, most of these services, you pay nothing. Please take advantage of these services. Get your preventative shots. Thank you very much for your time. Have a blessed day.